Hello everyone, welcome to Unacademy Future Doctors. Am I audible and visible? Let me know. Then we'll start our class. Am I audible and visible? Okay. Am I audible properly? Am I audible properly? Okay. Hello everyone, welcome to Unacademy Future Doctors. I myself, Dr. Dipti I am MD PhD Physiology. I am Associate Professor and educating MBBS, MD students as well as physiotherapy and nursing students. And I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two types of subscription. One that is plus subscription, in which you can choose the best from the best. Here, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access QuestionBank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. And within 12 months, we are coming with our printed notes. Okay. Now, Yuvraj Chaudhary, beat the NEET exam together. Good. Yuvraj Chaudhary. Okay. Welcome. Now, next is our iconic subscription. Here, your access to the best from two of the best. We have two options. One, that is Unacademy and Prep Ladder with Unacademy, in which we have the features. We have well-structured live batches. We will provide you recorded classes which covers your full syllabus. We'll give you question bank which is having more than 25,000 questions. You can compete in the live test as well as quizzes. We will also provide you comprehensive printed and digital notes. And second one, that is Unacademy and Prep Ladder with Prep Ladder. Here in this option, we'll be having clinical and integrated essentials, video lectures from our dream team. We'll provide you question bank 3 with active guidance, system tags and more, rapid revision and snapshots and treasures and 2021 dream notes. So both of them are unique in their own. You can subscribe any of them. Now, we also have added certain features in our special class, and they are: one, we made the classes interactive. These are interactive live classes. You can attend the live class as well as you can participate in our live chat and get your doubts clear. Second, that is you have an option of raise a hand. You can talk to your educator in the live class and get your doubts resolved in the real time. Also, you can poll for the learner. Respond to the poll for a better understanding of a topic. You can never miss a class as you're always notified for your classes. Lecture notes. You'll be given lecture notes as well as you can download lecture notes from the sessions, special sessions. We will upload our lecture notes. You can download from that. You can attend your classes anytime and at anywhere. Okay. Now, another feature we have added, that is we have updated and highly effective question bank, which is having, as I told you, more than 25,000 high yield clinical questions. These questions are based on your latest exam pattern. And along with that, you have detailed explanation. What is Yuvraj Chaudhary? Beat the NEET exam. Please guide and when you will start 2021 batch classes. 2021 batch means first MBBS, na new classes. Yuvraj, you are talking about you are waiting for the admission. Let me know. You completed your NEET UG in 2021. Is it? And I think you are waiting for your first year admission. Am I right, Yuvraj? Telegram group. We have already a Telegram group of Unacademy. You can join that. Okay. Yuvraj, let me know that you are preparing. I think you are waiting for your admission. Am I right? Hmm? Is it? Okay. So, let me clear. From tomorrow onwards, today is the last class for the previous year batch. From tomorrow onwards, we are starting our new class, new batch. Okay. Tomorrow is my special class. Okay. I told you yesterday also, just let me explain. I told you yesterday also that there is a special class that you can unlock my special class through my code after going in the app. So how to open the special class? First, you just download the app Unacademy Learners app, okay, and then you can access my class by using my code Dipti10. Okay, tomorrow is the class for your how I will teach you how to start your first year. Okay, I will guide you, and from 1st January, 31st is a holiday, your celebration day. Okay, so from 1st January we will start our classes. Regular classes will be there. Okay, regularly 1 hour, maximum 1 or 1.5 hour. Okay, me and another teacher, another doctor, Dr. Sheetal, we both will take your physiology. We have another teacher for anatomy and biochemistry. So all the subjects of first MBBS will be taught. And we are starting our teaching from 1st January. So please tell your all the friends. Okay, they also can join us from 1st January. Am I clear? Hmm? Tomorrow is also an important class. If you wish to join and your friends they want to join, please share this app as well as my code. They can, and timing of the class, that is 9 to 10 p.m. tomorrow, 9 to 10 p.m. Okay, so this special class also will be very helpful. How will you study in your first MBBS, that we will discuss in our special class. Okay, so tomorrow is just a planning class. uh Thank you. I'm overwhelmed. Huh? Not okay. If you all are getting good from we people, that is our pleasure. Okay. We are always here to help you. Okay. But please share with your friends. Tomorrow we'll be having special class on Unacademy app, and this special class is also free. You can access this class. Just you have to download your app, download Unacademy app and use my code, and you can access that special class. Okay. Okay, thank you, thanks a lot. Okay, let us continue today's session. Okay. I will share you, because at present I don't have it. I don't have the link that is there in my laptop, so I'll share you by tomorrow. Okay. We don't have our personal Telegram link. I'll share you Unacademy Telegram link. Okay. Okay. I don't have at present. That is there in my mobile, and at present I cannot explore it because my class is live. Okay. Now, so let us continue. So here also we have Unacademy medical PG test. We have various schedules in December, so that you can come to know that we have all this test during the year. Okay, so this is just a schedule for educator curated test series, FMG grant test series, study with me YouTube test series, Saturday special class marathon based test series, grant test series, medical PG 2022 subject wise test series, medical PG 2022 grant test series, next 2023 system wise test series. So all these are our test series. Okay. Now, also we have started our Focus FMGE 2022 comprehensive batch, which has been started from 15th December. Okay, this is for 6 months. And second, that is Target NEET PG 2022 test and discussion batch that was started from 15th December and the duration is 3 months. Okay. Now, you can subscribe any of our subscription plus as well as Iconic. You can use my code Dipti10 to get 10% extra discount. Okay. Longer the duration of subscription, cheaper are the rates. You can see that rates are so cheap. For 3 subjects you are getting in this much cost. Okay. Now, let us start with today's topic, upper and lower motor neuronal lesion. Okay. So now this topic, theoretically it is important, practically also it is important. This is a small topic, not a big one, but in clinical also you will learn. If you know this, what is the upper and lower motor neuron, it is slightly confusing for the students in physiology also, in medicine also. This is as such a small topic, but if you know it, you can come to know you by the symptoms. If you see that suppose there is muscle flaccid paralysis, then you definitely say that this is lower motor neuron lesion. If there is spastic paralysis, you definitely have the click that there is upper motor. So there are certain points which are clinically also very important in today's topic. Okay, now starting with what is upper motor neurons and lower motor neurons. Okay, now, so as the name suggests, motor neurons. Motor means they start from brain and to the periphery. Sensory means periphery to central nervous system. Motor means CNS to periphery. Okay. So this, any motor tract has got 2 neurons, upper and lower motor. Okay. Sensory tract has got 3 neurons, first, second and third order neuron we discussed. Okay. Now, so this upper motor neurons, these are the neurons giving origin to the fibers of pyramidal and extrapyramidal tracts. So this pyramidal and extrapyramidal tracts, they form your upper motor neuron. Okay. And so this you can see starting from brain, pyramidal or extrapyramidal up to the spinal cord. This is your upper motor neuron. Lower motor neurons here, these are from anterior horn of the spinal cord, the neuron starts and supplying muscle, that is lower motor. So this, either it starts from spinal cord or from the brain stem, various nuclei are there. So cranial and spinal neurons, they are lower motor neurons. Okay. So this is first, this basic thing must be clear. Pyramidal, extrapyramidal neurons are upper motor neurons and cranial and spinal neurons are lower motor neurons. Okay. What happens in upper and lower motor neuronal lesion? So upper motor neuron lesion means lesion of pyramidal and extrapyramidal tracts. Okay. And lower motor neurons lesion means lesion of this one. Neurons, they start from brainstem or spinal cord. Okay. So these are another thing, as I told you, lower motor neurons are cranial and spinal neurons. So in brain also there are nuclei and in spinal cord also this is a neuron, that is lower motor. So if suppose lesion is somewhere here, this is upper motor neuronal lesion. Okay. And if lesion is here, starting from this, either maybe in the spinal cord or sometimes the nucleus starts from the brainstem area. So brainstem lesion also may be lower motor neuron type of lesion. Okay. Now, site of lesion, as I told you, in case of upper motor neuronal lesion, the site is either in the cerebral hemisphere, okay, or cerebellum or brainstem and spinal cord, anywhere. Why the spinal cord? Because you can see here, if in spinal cord also lesion is here, then this is upper motor neuron. Don't get confused that madam spinal cord is here, this is lower motor. It is not like that. Till this anterior horn we have upper motor neuron. So upper motor neurons, they end on the, you can see here, this is suppose your spinal cord. Okay, in spinal cord we have this ventral horn. Here your, from here lower motor neuron starts. So this one is your upper motor neuron. Okay, suppose lesion is here, then also you can say that is upper motor neuronal lesion. Okay, then lower motor neuron lesion, here you can see, if it is lesion in the anterior horn cell, this is anterior horn cell, this one, here, okay, or peripheral nerve or neuromuscular junction, anywhere from after this, if the lesion is there, then it is LMN lesion. UMN lesion occurs when there is any vascular lesion. You can see when there is a blood vessel gets ruptured. So here you can see these all neurons are damaged. Okay, or some hematoma is there, space occupying lesion, tumor is there, then these neurons are affected. Whereas this lower motor neuronal lesion is commonly in the poliomyelitis. Okay, where this motor neurons are affected. Okay, now next is muscle weakness. Which type of muscle weakness? If there is upper motor neuron lesion, there is either quadriplegia. Suppose if the injury or if the neurons affected above the spinal cord, then all four limbs are paralyzed. Then paraplegia, if lesion is here, lower limbs are paralyzed. Or hemiplegia, half of or one side of both the limbs are, upper limb and lower limb are paralyzed. Okay, then in lower motor neuronal lesion, what happens? There is myopathy or neuropathy. Myopathy means disorder of muscle. Okay, wasting of muscle. Okay, disorder of muscle, that is myopathy. Okay, or neuropathy, peripheral neurons, nerve fibers are affected, that results in tingling, numbness, pin needle sensations, burning sensation, okay, loss of balance. This is all found in neuropathy and in lower motor neuronal lesion. Okay, muscles involved in upper motor neuronal lesion, you can see here, this is upper motor neuron. When lesion is there in the upper motor neuron, the whole group of muscles are affected. Whereas in lower motor neuron lesion, only single muscle fiber is affected, which is supplied by this nerve, this one. Okay, then what happens to tone? This is important diagnostic feature of upper motor neuron, lower motor neuron lesion. If there is upper motor neuron lesion, muscle tone increases, that is produces spasticity, spastic paralysis. Okay, so you can see muscles, they become stiff. Why? Because your upper motor neurons, they control lower one. So when this control is lost, there is excessive discharge and that results in increased muscle tone. Whereas in lower motor neuronal lesion, there is flaccid paralysis. Okay, tone is lost, there is flaccid paralysis. Okay, because these muscles are, these neurons are important to maintain tone of the muscle. Okay, so that is flaccid paralysis. Okay, now next is reflexes. What happens to reflexes? Sorry, in upper and lower motor neuronal lesion. In upper motor neuronal lesion, your superficial reflexes are lost. Superficial reflexes, we all know that conjunctival, corneal reflex, abdominal reflex. Okay, so these all are lost. And deep reflexes are exaggerated. They are they are elicited not normally more than that because of spasticity. And in lower motor neuronal lesion, both the reflexes are lost. Okay. Then important thing here is in upper motor neuronal lesion, Babinski sign is positive. This is Babinski sign. What is this Babinski sign? How to eliciate here? Normally, when we eliciate plantar reflex, we are scratching the skin of the sole, like here you can see, with pointed end of the hammer. What happens? Normally, there is adduction of all the toes, you can see, and plantar flexion. This is normal response. Plantar flexion and adduction of all toes. That is normal response. Okay. But what happens in Babinski sign? Whenever you are scratching here from heel to toes, fanning of all the toes, or it is known as abduction of all the toes. And second thing is not plantar flexion. Babinski is also known as extensor plantar reflex. Extensor plantar reflex, or in other words you can say that dorsiflexion. Okay, so this is Babinski positive. Okay, here when in upper motor neuronal lesion, whereas this Babinski is negative, you can see here this is extensor plantar response. In lower motor neuronal lesion, Babinski sign is negative. Okay, so this way. Now next is which are the findings in EMG. EMG means electromyography, muscle electrical recording of muscles. Okay, so here in upper motor neuronal lesion, what happens? Normal nerve conduction. Nerve conduction is normal and firing rate decreases. Decrease in firing rate. Whereas in lower motor neuronal lesion, what happens? This nerve conduction is abnormal. Nerve conduction is not normal, abnormal. And muscles thick are shown. Fasciculation means twitching. Fasciculation and fibrillation. Okay, so these are the feature of lower motor neuron. Okay, so this way we can differentiate upper motor neuron lesion from lower motor neuron lesion. Now let us enumerate the whole. Okay, you can see here, you can write down this table also. If you have a short note, you can write this table and all the details you can explain. Okay, so now upper motor neuron, as I told you, pyramidal and extrapyramidal neurons are upper motor, whereas cranial and spinal neurons are lower motor. Okay, now site of lesion, upper motor neuron lesion, site is cerebral hemisphere, cerebellum, brainstem and spinal cord. Whereas in lower motor neuron lesion, the site is anterior horn cells in the spinal cord, nerve roots, peripheral nerves, neuromuscular junction and muscle. Anywhere if there is lesion, it is lower motor. Muscle weakness in upper motor neuron lesion, quadriplegia, hemiplegia, diplegia or paraplegia. Whereas in lower motor neuron lesion, myopathy or neuropathy. Muscle tone is increased in upper motor neuronal lesion, so there is spasticity or rigidity. Whereas muscle tone decreases in lower motor neuronal lesion, there is flaccid paralysis. Okay, flaccidity, flaccid paralysis. Okay, fasciculation absent here in upper motor neuronal lesion, present. Most of the time this fasciculation found particularly in the tongue. Tendon reflexes are exaggerated. As I told you, in upper motor neuron lesions, superficial reflexes are lost. Deep reflexes are also known as tendon reflexes. They are exaggerated, hyperreflexia. Exaggerated, okay? And here they are not exaggerated, okay? Then abdominal reflexes, as I told you, superficial are lost here in upper motor neuron. So they are absent. Here sometimes they are present. Sensory loss in upper motor neuronal lesion, cortical sensation, whereas lower motor neuronal lesion, peripheral sensation. EMG also be discussed. Nerve conduction is normal here, whereas in lower motor neuronal lesion, nerve conduction is abnormal because nerve itself is getting damaged. So there is fasciculation, twitching and fibrillations are present. Okay. Now, one of the example of lower motor neuronal lesion is your Bell's palsy. Bell's palsy. I think you must have heard the name Bell's palsy. That is infranuclear lesion of the facial nerve. Infranuclear, but other term is lower motor neuronal lesion. You can see here, this is upper motor neuron for facial nerve, starting from the brain. Okay, cranial nerve nucleus here. From the nucleus, second order neuron starts here. This is lower motor neuron. So if lesion is here after the nucleus, then it is Bell's palsy. Okay, so this is, you can see again, I'll explain you. You can see here, this is upper motor neuronal lesion. Suppose lesion is here. So what happens, you can see the fibers, they go to opposite side as well as same side in the facial nerve nucleus. Okay, from which second order neurons, or you can say lower motor neurons, they start and they supply face. Okay, so when lesion is here, this is known as upper motor neuronal lesion. But when the lesion is here after the nucleus, this is known as lower motor neuronal lesion. So when the lesion is after the nucleus, you can see upper and lower part of the face fibers, they both are affected because this has fibers supplying upper part as well as lower part of the face. But in short, that is another different question. But at present, you can remember Bell's palsy is lower motor neuronal lesion of facial nerve. Okay. So this is all about today's class. Thank you. If you like my class, you can like, you can share with your friends, and you can subscribe our channel Unacademy Future Doctors. Thank you.